Good day. My name is Gilbert². I'm a technical advisor at Anova Health Institute, a South African NPO. Our study is entitled Poor Guideline Implementation During Identification and Management of Clients with HIV Drug Resistance. The 2023 South African National Department of Health ART Clinical Guidelines outlines a management cascade for clients with virological failure. The management cascade is made up of a number of steps. The first is to identify clients with confirmed virological failure, which is defined as 2 viral loads greater than 1,000 copies per ml. Once a client has been identified, the clinician assesses the client's adherence. If adherence is assessed at greater than 80%, the clinician performs a genotypic resistance test. If the genotypic resistance test confirms HIV drug resistance, an application is submitted to the National Third Line ART Committee for a tailored regimen. Once the client's regimen has been switched, they are to have continuous viral load and CD4 count monitoring. While essential for viral suppression, good clinical outcomes, and achieving the third 95, data on implementation fidelity remains limited. Our study interrogated data from the National Department of Health, National Health Laboratory Service, and Third Line ART Committee between January and May 2024 for 5 districts, including 3 urban districts, Johannesburg and Steegen in Gauteng Province and Cape Town in the Western Cape Province, and 2 rural districts, Mopani and Capricorn in Limpopo Province. For the purposes of our study, HIV drug resistance was defined as protease inhibitor or integrase strand transfer inhibitor resistance. Analysis include genotypic resistance testing coverage, results, and third-line ART applications, and then subsequent clinical management was interrogated using a combination of results obtained from the clinical electronic results management portal of the National Health Laboratory Service, which is called TrackCare, and clinical record review. And chi-squared tests were used to assess the differences in proportions. In terms of results, in June 2024, 3.6% of all clients on ART in urban areas and 3.5% of all clients on ART in rural areas had a viral load greater than 1,000 copies per ml. In terms of genotypic resistance testing coverage, there was greater coverage in urban than rural areas. And in terms of HIV drug resistance confirmed, there were more clients confirmed with drug resistance in the rural areas than in the urban areas. Out of all clients with HIV drug resistance, 77% of clients had a third-line ART application submitted. We were unable to confirm regimen switch for all clients. At 6 months post-genotypic resistance test, more than half of the clients lacked a follow-up CD4 count, and approximately 1/4 of clients lacked a follow-up viral load. In terms of the cascades, you can see that 884 clients had a genotypic resistance test. 29% of those clients had confirmed HIV drug resistance. 77% of clients had a third-line ART application submitted, and 87% of clients resuppressed to a viral load of less than 1,000. But if you interrogate the data comparing clients with HIV drug resistance and those without HIV drug resistance, you can see that there's a vast difference. Clients with HIV drug resistance were more likely to have higher CD4 counts and lower viral loads compared to clients who had no HIV drug resistance. So we concluded that there are still gaps in the management cascade for clients with confirmed virological failure, and the gaps include inadequate genotypic resistance testing coverage, especially in rural areas, insufficient third-line ART applications, and poor follow-up monitoring. The management of clients with confirmed virological failure is complex, and many clients continue to have high viral loads and low CD4 counts. Effective third-line ART regimens are crucial for viral suppression and immune recovery, and clinicians must prioritize accurate management of clients with confirmed virological failure, including intensive sustained adherence support and comprehensive advanced HIV disease care. Thank you.